Indigenous Rights Radio, because knowledge is power.
The 75th anniversary celebration for the World Health Organization will take place on 7th April 2023, which is also World Health Day. The World Health Organization was founded in 1948 to promote health and to help the vulnerable so that everyone, everywhere, can achieve the highest level of health and well-being. During WHO's 75th anniversary year, we can celebrate public health achievements that have improved quality of life over the past 7 decades. In addition, it is an opportunity to motivate action to deal with today and tomorrow's health challenges. In this radio program, we will be looking at diseases and health issues that affect and impact Indigenous peoples.
According to UN.org, globally, Indigenous people suffer from poorer health, are more likely to experience disability and reduced quality of life, and ultimately die younger than their non-Indigenous counterparts. Indigenous women experience health problems with particular severity as they are disproportionately affected by natural disasters and armed conflicts and are often denied access to education, land property, and other economic resources. Differences in infant mortality between Indigenous and non-Indigenous populations reflect the structural inequalities of these groups on an international level. Many of the most widespread causes of mortality among Indigenous children are preventable, such as malnutrition, diarrhea, parasitic infections, and tuberculosis. Indigenous youth and adolescents face particular challenges in the realization of their right to health that are often not adequately addressed, including sexual and reproductive health and rights and mental health. Statistical and health data collection is a key challenge in addressing Indigenous health disparities across the world and within regions.
Worldwide, over 50% of Indigenous adults over the age of 35 have type 2 diabetes, and these numbers are predicted to rise. In some Indigenous communities, diabetes has reached epidemic proportions and places the very existence of Indigenous communities at risk. Indigenous people suffer from poorer health, are more likely to experience disability and reduced quality of life, and ultimately die younger than their non-Indigenous counterparts. The gap in life expectancy between Indigenous and non-Indigenous people in years is Guatemala 13, Panama 10, Mexico 6, Nepal 20, Australia 20, Canada 17, New Zealand 11. Tuberculosis, a disease that primarily affects people living in poverty, affects at least 2 billion people in the world. As a result of poverty, tuberculosis continues to disproportionately affect Indigenous peoples around the globe. While programs have been designed to combat tuberculosis, they often do not reach Indigenous peoples because of issues related to poverty, poor housing, a lack of access to medical care and drugs, cultural barriers, language differences, and geographic remoteness.
Indigenous peoples experience disproportionately high levels of maternal and infant mortality, malnutrition, cardiovascular diseases, HIV/AIDS, and other infectious diseases such as malaria and tuberculosis. Indigenous women experience these health problems with particular severity as they are disproportionately affected by natural disasters and armed conflicts and are often denied access to education, land, property, and other economic resources. And yet, they play a primary role in overseeing the health and well-being of their families and communities. In addition, as incidents of other public health issues such as drug abuse, alcoholism, depression, and suicide increases, urgent and concerted efforts are needed to improve the health situation of Indigenous peoples. Poor nutrition is one of the health issues that most affects Indigenous peoples around the world. In addition to circumstances of extreme poverty, Indigenous peoples suffer from malnutrition because of environmental degradation and contamination of the ecosystems in which Indigenous communities have traditionally lived, loss of land and territory, and a decline in abundance or accessibility of traditional food sources. To address the root causes of Indigenous peoples' health problems, there must be full recognition and exercise of Indigenous peoples' collective rights to communal assets and self-determination. Many health issues such as depression, substance abuse and suicide have been identified as connected to historical colonization and dispossession of Indigenous peoples, which has resulted in the fragmentation of Indigenous social, cultural, economic and political institutions. Models of healthcare must take into account the Indigenous concept of health and preserve and strengthen Indigenous health systems as a strategy to increase access and coverage of healthcare. This will determine the establishment of clear mechanisms of cooperation among relevant healthcare personnel, communities, traditional leaders, policymakers, and government officials.
Existing conventions governing the use and disposal of toxic chemicals and wastes do not adequately protect the rights of the world's most vulnerable, including Indigenous peoples, who disproportionately suffer from their indiscriminate and irresponsible use. As such, there is an urgent need to create a global, legally binding regime for toxic industrial chemicals and hazardous pesticides to protect the rights of everyone, including Indigenous peoples. Such a regime should have strong accountability and compliance mechanisms and be in conformity with international human rights standards, including the United Nations Declaration on the Rights of Indigenous Peoples, the Convention on the Rights of Indigenous Peoples with Disabilities, and the Convention on the Rights of the Child. Indigenous midwives. Traditional Indigenous midwives, cultural and clinical knowledge, and their contributions to the well-being and positive health of Indigenous peoples are largely unacknowledged and sometimes undermined by national health systems. Therefore, Indigenous midwifery must be supported by state health policy and integration.
Maternal health and mortality. Across the globe, Indigenous women and adolescents face persistent inequalities and stigma, especially in relation to maternal health and maternal mortality, yet the lack of data in this area renders them invisible and presents a major barrier to efforts to address the issue. Cultural perspective. Indigenous peoples have consistently urged the UN system, regional health organizations, and governments to fully incorporate a cultural perspective into health policies and programs and reproductive health services aimed at Indigenous women. Furthermore, the roles of traditional midwives should be re-evaluated and expanded to assist Indigenous women during their reproductive health processes and act as cultural brokers between health systems and the Indigenous community's values and worldviews. The above is taken from UN.org. For more on the rights of Indigenous peoples, visit cs.org and follow Cultural Survival on Facebook and Twitter.
Indigenous Rights Radio, because knowledge is power.